My name is DJ Chuang, the Director of Christian Asian Mental Health. Thank you for clicking play on this video. I know you have many other choices of talks and presentations during this mental health summit. I'm grateful for the opportunity to share with you about breaking barriers for the urgent mental health needs among Asian Americans. I myself am an Asian American of Chinese heritage who came to the United States when I was 8, and that was 50 years ago. And what brought me into this mental health journey is my own lived experience, having been diagnosed with bipolar disorder 24 years ago at the age of 35. It was a very challenging time in my life, and I've learned so much over the years of how to live in recovery with treatment, with community, with faith. And I want to share with you some of the barriers that keep many Asian Americans from living a life of thriving because, on the whole, Asian Americans are the least likely to seek mental health treatment. I'll be sharing with you some slides with a lot of information. You don't need to take copious notes. Feel free to contact me by email, by phone, or the website, camh.network, and I'd be happy to share these slides with you and connect with you about how we might work together to serve this great need of mental health, especially among Asian Americans, but amongst all peoples. Here are some top line statistics about why there are urgent mental health needs among Asian Americans. Asian Americans are the least likely to seek mental health services compared to any other racial or ethnic group, 3 times less likely than their white counterparts. There's also a rising tide of anti-Asian hate in America, aggravated by COVID and racial tension in our times. There's a website called Stop AAPI Hate that has tracked over 11,000 racial hatred incidents, some of which are just verbal slurs, some of which are actually physical violence. And that's probably underreported, but it is creating discomfort and trauma for many Asian Americans, even in California and New York, where there are significant populations of Asian Americans. And most urgently, there's a crisis of suicide and depression and anxiety amongst Asian Americans and Pacific Islanders. It is the highest leading cause of death among Asian Americans in the ages of 10 to 19, a second leading cause of death among those 20 to 34. And a most recent report that just came out this summer has noted that Vietnamese Americans are particularly at risk of suicide. They have the highest rate of suicide amongst all young adults. So these are serious matters that need attention, especially when Asian Americans are not getting the care and support and the treatment that they need when it comes to mental health challenges. Now, there are 4 major barriers that keep Asian Americans from receiving mental health treatment. Number one, it's the lack of accessibility. Language barriers make it difficult for Asian Americans to get treatment. 32% of Asian Americans do not speak English fluently, and the vast majority, like 86% of Asian Americans, speak something other than English at home. So you do the math. So there's a small percentage of English speaking therapists or counselors or psychiatrists that can actually help this population of Asian Americans, around 25 million at the time, as I'm sharing with you. Some people have estimated over 800 spoken languages of Asian languages and dialects exist in America and around the world. And the top 5 languages are Chinese, Tagalog, Vietnamese, Korean, and Hindi. And that covers about 70% of Asian Americans, but the other 30% are people that need help and care just as much. So lack of accessibility is number one. Number two is lack of affordability. You and I know how expensive it is to get mental health treatment. Insurance often doesn't cover the cost, at least not beyond 5 or 10 sessions at the most. And then, not to mention, there are many Asian Americans that don't have health insurance. So, um, one in five have even said, according to the slide, that their insurance doesn't cover mental health treatment. That's 20%. And then, as I mentioned briefly, many among Asian Americans live below the poverty line, and some significant percentage don't have insurance. So how are they going to afford that treatment? They can't. Number three, lack of availability. So suppose they can have access to a language that they can speak. Suppose they can find someone that they can afford, but they may not be available. I just was in a conversation with some therapists in Northern Cal, and it is very hard to find an available therapist, much less one that is the same Asian ethnicity that perhaps can speak the same language that can serve their mental health needs. So there's a shortage of providers that are culturally competent and racially sensitive to serve the Asian American population. And a behavioral health office visit is over 5 times more likely to be out of network than primary care appointments. So this lack of accessibility, lack of affordability, and lack of availability, these are three of the most difficult barriers to break when trying to get mental health care to Asian Americans. And there's a fourth one that I will add, particularly acute and affecting Asians and Asian Americans, and that's the lack of accessibility. I want it to alliterate, so there's 4 A's, but when I say the lack of accessibility, that's the issue of shame and stigma. So discussion of mental health issues among Asians and Asian Americans, it's particularly challenging, considered it's taboo. So it's very easy, very common to dismiss or deny or neglect when there's symptoms that arise that are part of our human experience because life sometimes is hard and there's challenges that affect our mental and emotional well-being. There's also the pressure to live up to the model minority myth that affects many Asian Americans when they're not as successful as they might expect of themselves or family might expect or society might expect. There's also this factor called face-saving behaviors that the Asians and Asian Americans have a quantifiable reluctance to lose face. And then to quantify, to show you just how much shame affects the Chinese culture, there's 113 terms related to shame in the Chinese language. That's more words than Eskimos have than for snow. So those four factors make it very difficult for Asian Americans to get mental health treatment. Stigma and shame is such a big factor. In one survey, 80% of people say that shame, stigma, and discrimination can be worse than the impact of the mental health condition itself. Now, there's a World Health Organization called the Lancet Commission that did a research with 40 plus experts, and their conclusion was when it comes to the issue of stigma, that people with lived experience of mental health conditions are the key change agents for stigma reduction. Now, you and I know that there's a lot of funding and expertise in the professional healthcare field in psychiatry and psychology to help people with mental health challenges and disorders. But how in the world do we activate and mobilize people with lived experience to address this issue of stigma? It's not really something we can do with just campaigns or programs. It requires changing culture and it requires people stepping in to the gap. And I want to propose to you, share with you, invite you as churches, churches consisting of people who follow Christ, filled with the Spirit and hearts of compassion and care, that we are the people that can make the biggest difference of this opportunity for helping people heal and be cared for and supported in their mental health challenges in their everyday life in a way that counseling and therapy and medication cannot. They both go together. They're complementary, but there's a vital role for churches to play. And you'll hear that in some of the other talks mentioned already, but I want to get right to the point in terms of the solution. So the fifth A, so I have five A's in this talk and five S's. The fifth A in this short talk is activate. There are things that we can do to activate your church to care and support people with mental health struggles. And it doesn't cost a lot. There are people already with lived experiences going through the struggles of human life that can help others receive the comfort that God has given them through those challenges of life. 2 Corinthians 1 tells us that's one of the reasons God has brought us healing and comfort so that we can in turn give comfort, care, and support to others. So, five ingredients for mental health ministry. This is the quick start guide that I'm able to provide coaching and resources to help, particularly Asian American churches, launch their mental health ministries. But these five ingredients work in American churches, Asian churches, and churches of any kind, any grouping of people, wherever your community exists. And they're very simple. They all start with the letter S: sermons, stories, seminars, support, and Sabbath. Let me briefly explain what each of these are. They're self-explanatory, but let me talk through it. All right. Number one, sermons stop stigma. The Word of God is one of the best. I mean, it is the best book that describes the human condition. Both Christians and non-Christians acknowledge the value of the Bible. And for those of us who are followers of Christ, the Bible is the Word of God. It is the Word of life. It gives us a compass north to what is truth, and it gives us everything we need for uh, righteousness and correction and living by God's truth of blessing and goodness. And it speaks to the human condition when we struggle with depression, anxiety, worry, grief, suffering. And the vernacular of the day is mental health. Sermons Stop Stigma. This was a quote from a 2016 talk by Dr. Ed Stetzer at a conference regarding mental health. And a little trivia here about this particular photo. The sermon is one where Dr. Stetzer talks about suffering, but the allusion, the trivia, is Dr. Stetzer gave a talk, a sermon on live stream in 2017, and someone counted that Dr. Stetzer adjusted his glasses 76 times in the first 36 minutes of his sermon. Um, and that was a bit distracting to this person that noticed it. But levity aside, sermons stop stigma. We want to be grounded in the word of truth and recognize that having a mental health diagnosis, struggling with mental health challenges is not a sin, but is part of being human, and God cares for us when we struggle with the things of life. And we too, as God's people, can and should care and support others going through mental health challenges. And so talk about mental health in your sermons because it's already there in the Bible. And use the language of the day to connect with people of today. Number two, stories erase shame and stop stigma. Stories really humanize the struggles that we all experience. So whether it's just relating to someone else that's struggling in the pews or in your community, sharing stories of lived experience helps others to relate and touches the heart. So we want to touch the head, inform the head, and touch the heart of people so that we can erase the shame and stop the stigma regarding mental health. So having healthy, honest conversations can make a huge difference to help people realize it's okay to struggle and there's help and there's hope and you're not alone. This photo is actually the first time I shared my testimony at a mental health gathering at my home church, Saddleback Church. You may have heard of it. And we have had a monthly gathering every month to create a space, a community to educate and encourage one another regarding mental health. And there's such a powerful connection between faith and mental health that's not often talked about in the mental health space and often not addressed in the faith space. And we can bring that together and really help so many more people. I mean, think about it. There's no greater felt need than someone who is struggling with mental health challenges. And it doesn't have to be a long-term diagnosis. It can be a short-term challenge. Long-term, short-term, we all experience it from time to time. Number three, seminars. Seminars equip everyone for mental health, whether it's burnout, stress, managing depression, anxiety, suffering, or a DSM-5, the Diagnostic Manual for Official Mental Health Disorders. All those things are under the rubric, the category of mental health challenges, and the church can be a place that hosts seminars that help people to understand because people are afraid. When people are afraid or ignorant of what mental health is, then we tend to stigmatize and separate ourselves from it. But the church can step into that gap and really help people to realize it's okay to not be okay. God is for you. The people of God are here to help. It's okay to seek treatment. It's okay to be on medication if that's what's needed. One of the things I've discovered in my own mental health journey, it's a very personalized and customized path of recovery. So it's not a one size fits all. Each person has to recognize and develop their own path of healing and recovery and being well. And they need encouragement along the way that it's okay to try a different doctor. It's okay to find a different therapist that fits better. And one of the resources that really helps the church leadership, and I would recommend a pastor team as well as lay leaders to go through this curriculum online, Sanctuary course, and the website is sanctuarymentalhealth.org. It's a free course, helps your church leaders to understand how to talk about mental health and have some basic understanding of how the church can be a place of caring and sanctuary for those who struggle with mental health. So just to get some basic education, it's an 8-week course online, great discussion guides, transcripts, everything's available for you to learn together. You can maybe even do it as a Sunday school class as a way to bring your church together into mental health ministry. Number four, support groups. Support groups provide care and community. And I wanted to highlight one of the curriculums I'm most familiar with during the past 3 years. I've been part of co-facilitating a Living Grace support group on Zoom. And that one is for individuals who struggle with mental health challenges. It doesn't have to be an official diagnosis. It can just be going through challenges of anxiety, depression, or stress. And what's amazing about this workbook, it's now free. The digital version is free for download from mentalhealthgracealliance.org. And it's a 16-week workbook. You can go through it individually, but it's so much more valuable to go through it with a group of others. Create a safe place for confidentiality, anonymity, and share together your life challenges and to know you're not alone. And the workbook gives you a faith section to ground you in spirituality, gives you a facts section to help you learn some of the neuroscience and the biology behind mental health challenges, and then future, some practical exercises for your wellness. And those three ingredients over the course of 16 weeks can really facilitate. There's evidence-based that helps people to grow post-traumatic stress growth. through this course. And then for family and friends, so if you're not a person that struggles with mental health currently, you might know someone who's a friend or family that struggle with mental health. The Family Grace Workbook is super helpful to support others who are challenged in mental health. Dr. Thomas Insel wrote a book titled Healing after he retired from the National Institute of Mental Health. And he's noticed that in his years of working as a professional in psychology and psychiatry, that individuals that are struggling with mental health, treatment alone is not enough. For them to have long-term recovery, they need three P's. And the three P's stand for people, place, and purpose. And for those of us who are followers of Christ, that sounds so much like the church. So the church has this tremendous, valuable opportunity to really step into the mission field to care for people struggling with mental health. In our day and age, that's 25% of any people group. It's not just Asian Americans, it's everybody. And your church can open its door, create space, a safe place, a sanctuary to show that you care for people with mental health in a way that counselors and therapists and psychiatrists do not, but we complement and work together because the need is so great. And finally, the fifth S is Sabbath. A Sabbath rhythm is a vital part of total health. Sabbath was demonstrated and modeled by God right there in Genesis 1, 2, and 3. And Sabbath is commanded in the Ten Commandments. It may not show up exactly in the New Testament, and neither do musical instruments, but Sabbath, even in Silicon Valley in the digital world, they've recognized that Sabbath is a vital part of total health. And particularly in the Asian and Asian American church world, some can overemphasize their spirituality and their faith and neglect their physical and emotional well-being. And that's why I needed to add a fifth S for this continuum of care for Asian and Asian American churches to have a culture and a continuum of care that can be called mental health ministry. There are many other S's you can add to build a more robust mental health ministry, but I think these five S's keep it simple, can get you started, and getting started is the first step, it's the hardest step, but it's such a bold step of faith to declare that your church cares and supports people who struggle with mental health. Very doable. And I would love to have the opportunity to connect with you and journey with you as you um, become a church known as a safe place that cares for people with mental health. Thank you for watching this video. I'd love to hear from you. Please contact me by email, by phone, and God's richest blessing to you as you bring health and shalom to your community.